respond to you with answers after the program. Also, I want to publicly notice that this program is recorded and subject to public disclosure pursuant to Connecticut Freedom of Information Guidelines. Now on to the program. I am so grateful and appreciative and honored to have our panel of experts who will provide insight from their experience and also share information from their area of expertise that will help guide you and your family through this challenging process. I want to begin by welcoming Commissioner Beth Bai from the Office of Early Childhood Education, which regulates and provides guidances to child care and camp programs throughout the state of Connecticut. Someone who I've worked with as a Senate colleague in the General Assembly, Commissioner Bai will outline the safety protocols that daycares and summer camps will be required to follow during the COVID reporting phases, but also some of the considerations that her office has been undergoing and engaging and interacting. I am so grateful for Commissioner Bai to be here, and I know she has another call, a conference call around 1 o'clock. So without any ado, Commissioner Bai, all yours. Thank you so much for being here.
Thank you for having me, Senator. I think forums like this are so important. We are in a pandemic, which means that things are very unpredictable. So the more communication, the better. That's what we say at OEC. Sometimes people feel like we're communicating too much, but mostly people need information, and especially where information changes as the CDC and State Department of Public Health change. I thought what I do today is walk through the summer camp guidelines, which very closely mirror the childcare guidelines. So parents who are listening and programs who are listening can have a clear sense of the public health guidance. But I really want to start, as you said, Senator Hwang, by thanking our child care providers, our summer camp providers. These are people that are going above and beyond to make sure that children have safe experiences and important experiences for their emotional health. It would be way easier to just not open camps this summer, and a lot of camps aren't. And it's really up to those camps if they feel comfortable that they can meet the strict public health guidelines. And it's up to families, as you said, who are making decisions about should I or should I not send my children to camp. So I thought what I'd do is very quickly, and then Senator Hwang, I will send you the PowerPoint so your people watching can look at it. It was developed with the Reopen Connecticut group, along with the education work group and the governor's office. So I'll walk through quickly the kind of public health protocols that are in place and that programs are agreeing to if they open this summer. Hopefully people can see the screen. Can people see my screen now?
Yes.
Okay. So this is really about safely reopening camps in Connecticut. And I think Governor Lamont and the senators and the members of the House, they've been very focused on keeping health and safety at the center. We want to both protect the health, make sure children are engaged during the summer, make sure parents who need to go to work can get to work and their children can be in a safe place, and incorporate folks as we move forward. I mentioned who was involved in developing this, and this just gives you the places where we've received input and adapted these guidelines. So what we're saying is that camps can open June 22nd. Some of that has to do, as Senator Hwang explained, with the phasing. So this is considered a phase 2 along with summer school. There are safety measures. One that is something that has changed with the new CDC guidelines is noticing parents about the risks of comorbidities. That if you have someone in your house with say, who's immunocompromised or has other health conditions, we're going to notice that you should take extra precautions if your children are going to camp. The other things quickly, our children will be screened for temperature. They have to have a place separate in case children get sick. Staff members will be required to wear face masks. There are small group sizes, extra cleaning and hygiene, changes in transportation protocols. And then there are also some waivers recognizing that it's hard for camps to get the waiver, that they get the fingerprints done and other requirements that are very difficult at this time, but there will be oversight and visits to the camps that are unannounced. So I mentioned that we will notice families about risks if they have family members or if they are working at a camp and 65 and older, they will be noticed of those risks. Camps will have to have a separate sick room in case a child begins to become symptomatic so they can be removed right away. These things are true in child care settings too. Children have to be screened on the way in for temperature. Anyone with a temperature of 100 degrees or over may not come. There's also, very specific protocols related to how that happens. This is something new, as all of you know, over the last couple of weeks, where we realized that face masks do make a big difference, and we are requiring that staff members wear masks. Individual camps may make decisions based on the age of campers, et cetera, about the campers wearing masks. It is not required in childcare settings, and children under 2 are not to wear face masks. Group sizes, this is a thing I think that in childcare has made the big difference. We have had about 1,500 childcare programs open since March, since the pandemic started. And we've required group sizes of no more than 10 children, but those 10 children stay in a group. So this is going to be challenging for camps, who are used to maybe sending campers, they mix and pick their activities. There's really going to be a pod of 10 children that are together to reduce the risk of disease transmission. But I've been listening to camps. They are innovating and thinking about ways to protect public health and give children great experiences. They're also going to be asked to, whenever possible, to add in social distancing strategies. For example, at the lunch table, have a space between children. I will say that youth sports will begin around the time camps begin. So there's some guidance about what sports will begin then that is not out yet, but camps will be encouraged to follow the guidance of youth sports when it comes to sporting activities at camps. They're required to report COVID cases to the local Department of Health and the State Department of Public Health if there are cases. And then this is more about where to report. And then really the local health department will guide whether the program can stay open or closes and give guidance about cleaning and disinfecting. One of the most important things for you to do at home, parents, and around town is hand washing. It makes a huge difference. So make sure that your children are washing their hands before they come to the program. The programs will have them wash their hands, and they will be doing hand washing and using hand sanitizer regularly. There are also different rules about transportation, requiring separation between students on the buses. And I mentioned that there are some licensing waivers that have been put in place to make it easier for camps to open while we'll be checking in and assuring quality. And for municipal camps, we'll be asking local health departments to be checking in on camps to make sure that they're following these guidelines. And that, I think that's enough because I want to save some time for questions, and also know that even though I have to hop off in 15 minutes, you can send questions to me at beth.by@ct.gov, and I will make sure that someone at our office gets back to you. And I'll be watching the tape of this, Senator, if you can send it to me so I make sure I hear the concerns and questions of these great providers that you have on the line. Thank you.
Thank you, Commissioner. And I know the program was looking at summer camps, but even before the summer camp consideration, there were a lot of efforts put into childcare. I mean, one of the unsung aspects of this is, childcare and camps were considered essential businesses. So they were technically not closed. But the reality was so many of the businesses closed, there really wasn't a need. because most of the caretakers stayed home. Now with the
Right.
change in this dynamic, can you elaborate a little bit on your time with regards to the
Yeah.
consideration requirements of childcare facilities? I believe the number is about 25% capacity. What's going to really happen when there's a growth in that need? And I think one of the reasons
Yeah.
that was given, was people not wanting to go back to work because they didn't have appropriate childcare. You have been an
Yeah,
incredible leader on childcare.
yeah.
So
I would say, Senator, we have a short-term challenge, but an even bigger, longer-term challenge. Childcare businesses have been challenged fiscally forever. Parents can only afford to pay so much, and it costs a lot if you're doing it well because you have to hire a lot of staff. So before the pandemic, our childcare programs were hurting. None of them are really, there aren't many making money on childcare. With the pandemic, and we said no group bigger than 10, that meant their tuition revenue is cut in half immediately. And that doesn't even take into account the fact, as you said, that parents were withdrawing their children because many were not working. So they had an issue of revenue, both from the demand of the public health guidance, because it's very strict, and because of parents feeling uncertain about bringing their children. But I think some of the unsung heroes of this pandemic are the childcare providers. Because when we looked at who was looking for childcare during the pandemic, a full 51% were hospital workers. And in second place were nursing home workers. Because friends and neighbors and informal arrangements weren't working so great for them because they were concerned about that their children might be infected because the parents were working in a high-risk environment. And so the childcare centers that stepped up at this time have really been part of the public health emergency response, and they have been incredible in their practices and their hand washing and screening. It's not been easy to operate, but the commitment to the families has been incredible. So many of the guidelines that I pointed out in my PowerPoint are the same for childcare programs. I think the piece I didn't mention was we're asking programs not to be bigger than 30 unless you apply to our office and show that you can maintain appropriate distance between groups of children. And we've had a great number of applications, but it just makes them talk through with our nurse that here's how, if we're bigger than 30, here's how we're going to do it. And here's how we're going to make sure that the groups have enough separation so that if there is a case, which they have been relatively rare in the 1,500 childcare programs that are open, we are working with DPH on a formalized way to collect that information right now because we don't have a formal process. But it rarely, in the couple of cases that I was involved with, it might have closed one classroom, but the rest of the program stayed open because the local health determined that the groups were not mixing, that there was cleaning between groups using the playground, for example. So they deserve so much credit for being open for those frontline workers. And the big challenge is, though, Senator, we can't forget about them going forward because most centers in Connecticut, I think it was 17%, had enough funds to last more than 2 months without their typical revenue. And we know they're not going to have their typical revenue at least through phase 2, correct? I mean, as we think about it, because we're already at 10 to 1. The gathering number is 5 to 1. It's going to move to 10 to 1. So we're really asking in DC for more federal dollars for childcare. And we will be, we're supporting programs with some funding now, but we're also going to be looking to support private programs who are getting ready to reopen or who have been opened to help them get through the next couple months with the lower enrollments. But the amount of money the state has is not going to be enough. The Center for American Progress estimates we could lose 45,000 childcare spaces in Connecticut, given the current conditions. So I think we all have to be, both the legislature, the governor's office, and our federal delegation working together, because without childcare, Connecticut doesn't work. So
without a doubt, and you have been such a tremendous leader, even in the General Assembly. You've taught me so much about that important role. And I know in the Housing Committee, we did pass a monumental zoning consideration, and I was fully supportive of that. And we need to address it. It's critical for us to reopen Connecticut and also to ensure that parents, as they go to work, have the quality assurances and the operations to be. So with the demand and the capacity growth, but also supply being limited, what would you say as a closing thought to many of those parents that can't find appropriate childcare facilities and they have to go back to work? What suggestions, what resources do you know that they can undertake?
Yeah, I'm so glad you asked that question. It gives me a chance to say, I think some of the big unsung heroes in this emergency have been the family childcare providers. Parents did continue to send children to those very small settings, probably because of the relationship, et cetera. But they have been bringing children into their own homes to care for them so parents can go to work as well. If parents are having challenges finding childcare, they can call 211 and ask for childcare, or go online to 211 childcare. We do have capacity in Connecticut right now. We do have childcare deserts. Before this happened, we had childcare deserts, and now with 2/3 of programs not open yet, I'm sure that's exacerbated. But I encourage parents. I think a lot of times there's a little bias about family childcare, like parents want to be in a center where they know there are a lot of eyes on the kids. But I myself use family childcare. It's a wonderful option, as are centers. So I think if you call 211 childcare and are looking for an opening, have an open mind to a center or a family childcare home, and know that they're all required to follow this public health guidance.
Okay, well, thank you, Commissioner. And I'm going to pivot a little bit. And while you're here, I wanted to acknowledge, I'm going to pivot to Diana Leptek, who is the Executive Director of the Fairfield Y, but also has a critical role in regards to the coastal Connecticut YMCA, which in southwestern Connecticut, unbeknownst to a lot of people, is one of the largest daycare providers and nutritional centers for families. So Diana, thank you very much for being here. And can you follow, and we're going to pivot a little bit and different from the program, but I want to take advantage of the opportunity for you with the Commissioner present for the brief moment to talk about the unique challenges that you have, not only from the funding that some federal funding has been allocated, but truly the real crisis you have in being able to provide quality childcare and daycare for constituents in southwestern Connecticut.
Thank you. And thank you for having me today. And I do want to thank Commissioner Bai for all of her support for programs and all the information that her office puts out and the town halls that they host. This has been a tremendous help for us. Currently, the coastal Connecticut YMCAs, their child cares for the most part are closed, with the exception of our New Haven Youth Center, who is, they are running a child care for emergency workers, and our Valley Y is set up to take on some children once the need is there. But we are looking to, with the state opening yesterday, we're looking to reopen our centers for the families that need quality childcare while they're back at work. Our Bridgeport Y is fully in the swing of reopening shortly, and the rest of our branches should follow. But childcare is such a big part of what the Y does. We miss doing it, and we're anxious to get back out there and work with our local health department as well as the OEC to make sure that we're providing quality and safe childcare.
With the new guidelines and the precautions that are undertaken and size and the cleaning precautions, how does that impact and where does that budget? I know Commissioner Bai talked about being able to get federal allocations and state allocations and prioritizing it. I completely agree. But how does that impact what you guys have to do? And the second question is, even though coastal Connecticut comes to Fairfield, are you coordinating with the likes of the Westport Weston Y, the Wilton Y, and further down the coastline? I know there are different operations of the YMCA, but are you all closely working together from a childcare, daycare type of programming?
So yes, the Ys are all working very closely together on several different levels with the Y of the USA. So most of our Ys participate in weekly, daily calls with the YUSA, where our sister Ys in the area are involved as well. And we reach out to one another to ask, questions regarding childcare and camp and different programs and reopening and things of that. So yes, we do collaborate with, as we call them, our sister Ys. To what Commissioner Bai was saying is that the new restrictions and new guidelines are going to have a tremendous financial implication on many of our programs. As a Y, we have not been charging our members since we closed. We haven't been obviously charging our childcare participants since we've closed. So that alone has impacted us. But going from a camp of close to 80 kids to possibly 30 is going to impact us, but it's not going to stop us from doing what we do best, and that's camp and childcare.
Thank you. And you do operate the summer camp in Trumbull, correct?
We operate. So the Fairfield Y has a camp. We have an outdoor center camp at in Monroe as part of our Trumbull YMCA. We have Camp Mountain Laurel and Hamden, our Valley, our Milford, Soundview. All of our branches do have summer camp.
And the final question is talking about capacity. If you plan to reopen as you are, would you be in a position to take on more because of your capacity and economy of scale? Would your organization be receptive to those that are listening that may have a need for childcare, that they can contact your organization to see where it can possibly fit?
Absolutely. So several of our branches have applied and have been granted the waiver for having more than 30 campers. So we are in the process of making sure that we can safely accommodate as many children as there is a need for.
Great. Thank you very much, Diana. I'm going to pivot to talk about, thank you, Commissioner. I appreciate your time. Thank you. I'm going to pivot to Anthony Calabrese, who is the Director of the Fairfield Parks and Recreation in regards to so many of the community activities. And thank you to the town first select woman, Brenda Kupchak, for her leadership and all the individuals. But Anthony, you've had a unique challenge with regards to recreational activities. But what maybe a lot of people don't understand is you run one of the largest summer programs for families during the summer, where you hire employees, but you also take in a lot of elementary kids in regards to activities, programs, and trips. So could you elaborate what you have been planning and undertaking so that for many of the families that are looking, is this business as usual, or is it a significant change?
Well, first, thank you, Tony, very much for having me on today. And thank you to the rest of the panel and Commissioner Bai for being here. These are definitely uncertain times, and we've never had to deal with the pandemic like we're dealing with today. As you said, we are probably one of the largest in the state as far as our summer camp program goes. We have about 4,000 kids that go through our program from the ages of 3 all the way up to high school age. Obviously, given what the stringent guidelines are going to be for this summer, we're not going to be able to accommodate those types of numbers. We're struggling right now to try to find locations to actually run these camps. And we're trying to rebrand things as not a summer camp, but more of a summer child care, because it is going to be different. It's going to have a much different feel with groups of 10 and potentially no more than 30 unless we get a state waiver on that number per site. So it's definitely not business as usual, but we are in a unique position where we can offer childcare, and we want to be able to do that safely and appropriately for as many people as we can. So that's our challenge right now, is just having enough locations, enough cleaning supplies to make sure we're doing it safely.
Is there any consideration of increasing the capacity as YMCA is undertaken? Are there internal discussions within the town to accommodate that? And what has been different in regards to making the application, capacity sizes. Tell people what the difference is so that they can plan accordingly. You know, we're talking about 80 now to 30 with some of the camps at the YMCA. What does that mean? Because I know my son has actually worked as a camp counselor. Would that also look at less hiring of counselors or less intake of an application? Could you kind of give some consideration ratios?
Sure. Typical summer, we have about 120 employees, seasonal employees, counselors that work for us for our summer camps. We've sent out a survey to all of our parents that were already registered for this year and last year. We've had several hundred of them fill out the survey. And we have a couple hundred that have deemed they need childcare, absolutely need childcare. So that's what we're trying to program for. With that being said, we are trying to keep on as many of our current staff as we had. So about 100 of them we would like to return. They may not be working full days. As far as the staff goes, we're going to try to see if we can get as many of them working half shifts, so at least everybody's still getting a little bit of work. But again, we want to try to keep the mixing between the groups to a minimum. So if it's 2 counselors per group and they're going to split the day, well, then that's how it's just going to be those 2. It's not going to be, you know, rotating 5 different counselors through there, or 6 different counselors. The groups aren't going to mix with each other. So like Commissioner Bai said, if you have a group of 10 students, that's what it's going to be. Those 10 are going to be that little cohort all summer. They're not going to, they can't be dropped off at the same time as another group that's being dropped off. Or if they are, they have to have different entrances to the building. When they're outside playing, again, they're completely separate. When they're inside in a classroom setting, they're going to have to be socially distant from each other. So again, that makes your typical camp games, whether it's duck, duck, goose, or playing checkers or chess, much different. It has a much different feel. So as a parent, that's going to be tough. That camp was always about socializing and being able to hang out with your friends while you're there, and it's going to have a different feel for sure. As far as the actual locations for Fairfield, we are having those internal talks right now with our Board of Education, with our libraries, our senior centers, other town facilities that we may have to lean on to see if we can use to try to create extra space if there is such a demand that we need to increase more locations.
Okay, thank you. And it's important. There are no guarantees in this pandemic, and it's always evolving. As I said earlier, phase 1 is open, but phase 2 is depending on future considerations. As the commissioner said earlier, there are health precautions and requirements that are in place. Now, I know that high quality from the first selectwoman on down is first and foremost the health and well-being of children, staff, and their parents, and interact with them. Can you share a little bit some of the unusual considerations that you've given to give some sense that this is a very serious matter and you're working very closely with the town's public health director to really facilitate a program as much as it's been altered and changed, that you've taken every precaution to ensure to the best of abilities. I'm going to ask that also of Wakeman as well, and the challenges that you all have. And could you elaborate a little bit for the listeners that are torn in some ways of what they have to do?
Yeah, absolutely. This offering the summer camp or summer childcare for us is definitely not a decision we're taking lightly. We've currently refunded every camp registration that we've had for this upcoming summer. And our plan is, once we have a solid plan, we will roll that out for a new registration for those who are interested, with all the details of what that program is going to look like. And all these decisions are being made in conjunction with school officials, our health officials, our emergency management team, and the first selectwoman's office. So again, we want to make sure that whatever product we put out there is, number one, it's safe, and number two, that it's a quality program that our residents can take advantage of. Those are always, our top priorities, but even more so in this pandemic situation.
Well, your program is obviously a leader in the general community. Has Fairfield and you, through your leadership role, facilitated plan? Would you be sharing that and interacting and collaborating with other towns and their various programs for people that may be listening in Westport, Weston, even down in Norwalk and Darien? Do you all talk to each other and share some of the protocols?
We do. I do a regional Parks and Rec director phone call every Monday at 2:00 with my other colleagues in Fairfield County. So we're all talking about the same things, the same challenges that we all face right now. There were talks at one point about, how can we help each other out? Are there different facilities that we could each partner up and use? Obviously, being in different towns makes that a challenge, but we are all facing the same challenges, and we're trying to share different solutions and come up with different ways that we could still offer this child care for this summer.
Well, thank you very much. And as a municipal operation, there is that burden and obligation in which, from the town leaders to the public health directors, you've taken the initiative. I'm going to pivot over to Wakeman Boys and Girls Club and welcome Sabrina Smeltz, who is the new CEO. And I want to thank David Blagas for his great work in the past. But you're a nonprofit, private organization that has done great work not only in Southport, Connecticut, but have branched out through boroughs. And you have a new center that's being built right now in Bridgeport. Share with the audience in regards a private organization that has a variety of education and activity camps throughout the year, and also big impact in the summer. What programs and what initiatives you've undertaken, even though it's not under the mandate of a municipal government guideline.
Like the other organizations on this panel today, our job is to bring kids together and bring people together. And that's a really challenging thing to do in a time where we're telling people to now stay apart. We have been doing, the moment that I think it was March 13th when we closed our doors, which seems so long ago, we have been reaching out and connecting to our members and our constituents by virtual programming, virtual activities. We are doing some small group mentoring programs that we have been able to take virtual, which has been really beneficial for us. We have some large leadership programs that serve our teens and middle school kids, where we are now doing that all virtually. So that has been our way to stay connected with the community throughout this time while we're not able to bring our kids into the clubhouses. We, like everyone else, have been working with our boards, our safety committee, local officials, to really make sure that we are preparing for an opening for camp, and we will be running camp. We have been fortunate to also apply for a waiver to be able to serve more than the 30 at both of our locations in Southport and in Bridgeport. But it's going to be a financial challenge. We, 2/3 of our budget come from fundraising and grants and programs. And if we can't run some of those programs, we aren't able and have funding for that. That's a challenge for us. But we know that we're going to be able to get through this and serve our kids. So that's really important. It's about making sure that we're there for our families, making sure we're there for our community, and working with other local organizations to do that. We have a Connecticut Alliance of Boys and Girls Clubs that serve the 16 clubs in Connecticut. We meet on a weekly basis to talk about challenges. We also had a summer task force put together to make sure that we're providing safe and quality care for our kids this summer, whatever that may look like.
Thank you very much. And what kind of precautions have you been taking in regards to training your counselors and preparing for protocols? And I'll ask each of you before we pivot to Michael Patota, is what considerations have you all had? And I'll begin with Diana and go the same order we went with anticipating supportive services, helping the kids go through some of the mechanisms of challenge in this pandemic, and also for parents. I'm sure you're fielding a lot of calls from parents who are asking all the various questions I've asked, and how have you handled that, and what have you seen? So, and after you answer, we'll pivot to Michael, who's been fantastic and waiting, but I felt it was important for him to close out and offer a lot of the emotional aspect that in some cases, a lot of parents don't want to readily admit. But Diana, if you could begin, what kind of interactions have you seen, and what have you built into to be able to try to support?
So one of the things that we did through the Connecticut Alliance with the Rhode Island Wise is we did send out a survey to parents asking them about camp and what they were looking for camp. As you can imagine, many of them have health concerns about a resurgence of the virus, but many of them want camp to look like camp. And we're trying to find that balance. But we are, one of the things we're doing is we're talking to our counselors, and we're having Zoom calls with them, and we're making sure that they know what camp is going to look like this year, so they're prepared for it. So they're not showing up a week before, 2 weeks before camp starts for their camp training and find out that the group sizes are much smaller, and these groups are going to be in a pack where they're traveling together all day. So we're making sure that we're educating our counselors on what camp is going to look like and how they could be supportive of children that may not have been out of the house and are going to be frightened by people wearing masks. So how can we help our counselors support our children? And I think for parents, each one of us that has a license have educational consultants and physician consultants, and we're relying on them to help them provide us with materials that we can share with our parents. And we also have social service representatives that are on our license as well. But just providing material for parents and reassuring them that, when we open camp, we will be following the guidelines to a T, and we will be providing a safe environment for their children. And we'll work with them together to make sure that the kids are happy and healthy.
Thank you, Diana. Anthony, you talked about something that's kind of amazing to me when I heard it the first time. You virtually refunded every applicant, and upon making a decision, you're going to reopen the applicant. But I got to be honest with you, as a parent who applied for the summer program, that was a competition. So I appreciate the caution, but what kind of precaution, what kind of initiatives have you undertaken to be able to train your counselors and to have their available resources to give parents a sense of comfort?
For us, it's all about communication, and whether that's communicating directly with the parents and the community as a whole, which starts from our first select women's office and trickles down through my office. We've been in constant communication with our staff as well, and we're very lucky as a municipality. We've got some really good resources on our hands from our Board of Education, our teachers and our counselors there in the school system, to our social services over down at the Bigelow Senior Center, to different community organizations like Fairfield Cares that offers all kinds of mental health things for us to work with our staff through. So we have a lot of those options at our disposal, really, to try to help our staff cope with what's going on. And then if we have parents reaching out to us, we also have that information that we're able to pass along to them. And I'm sure, as you know, Tony, we have a great health department here in town as well, and they are a wealth of knowledge. So we've really been leaning on them too.
Well, all of our health departments, they're in essence the frontline workers protecting our municipalities. Thank you, Anthony. And Sabrina?
Yeah, so our staff have been working tirelessly behind the scenes. Really fortunate that our teams, I would say they probably have put down 4, 5, 6, 7 different types scenarios, different ways for us to be able to really explore being safe, which is our #1 priority, making sure that families feel comfortable. We actually met with our safety committee last night to review our protocol and procedures that's going to be communicated out to all of our families and on our website, which is really important. We've done walkthroughs of our facilities to make sure the changes that we need to make to provide the proper social distancing measures, looking at classrooms, looking at outdoor space and how we utilize that better, so that we can run programs and make that a lot easier for our staff. Our staff, we are on calls daily with our teams, planning what will work, what won't work, where our concerns are. I think right now we want to make sure that, like Anthony said, our communication to our families of how we are providing this care is going to be safe and is going to be responsible. We have nurses on staff. We will have nurses on staff during camp that are consulting with us to make sure that we're following proper procedures. We have also worked with the local health departments, and that's really important. This is not, we are not in silos, and we are all working together to make sure that we're providing proper care. We have had calls with other emergency care, child care facilities that have been running during this time to ask questions about how they've implemented these rules. So from the OEC, it's great to read it on a piece of paper. However, how is it really happening in the real world? And that was really important for our staff to start to hear those guidelines being put into place, to understand that, yes, we can do this. We can make sure that our kids are having a safe, a quality program, and we're able to follow these guidelines. It's definitely going to be a different version of camp, but we are really confident that we're going to be able to provide the care that our families and our community needs. But it is going to, and it is challenging. I say we're out of the clubhouses right now, and actually we're having more time than ever to train our staff for camp. Usually we're running school and then we're starting camp right over. So we now have this opportunity, a lot of it's virtual, but to do more training for our staff and prepare them probably more than we ever have. And I'm sure Anthony and Diana and Michael can kind of to attest to that as well. So that's been to our advantage, and we're using that. We're working with nurses, we're working with others to help us with training to make sure that happens.
Thank you. And I want to move now to Michael Batota, who has been remarkably patient for the last hour, absorbing all of this. You are really wonderfully patient. But I wanted to close this whole conversation by kind of wrapping it around that we've done everything from a standpoint of procedure, facilities, et cetera. But one of the biggest challenges are the unsaid. First, the potential separation from parent to child, caregiver to child during this pandemic, and putting them out into a brave new environment, what that entails. I think the second component is really the emotion and maybe some of the possible guilt of saying, I've got to go back to work. And the separation anxiety of saying, I'm putting my kids out and I don't have people that I can, family that I can. Take us through the emotionals that you have seen and understand. But before you begin, can you share with the audience what the Child and Family Guidance Center does? Because what you do, as I mentioned earlier to the commissioner, you do tremendous work in behalf of children and family and mental health well-being in this community, and you don't get enough recognition. So thank you very much for your patience in being here and your willingness to offer your insight. I'm very grateful.
Thank you so much for inviting me. For those of you who don't know of the Child and Family Guidance Center, we offer outpatient mental health and family support services to over 4,000 children in Greater Bridgeport and Greater Norwalk every year. We really focus on trauma treatments for kids. 90% of the kids that we provide treatment to have experienced some form of trauma. Since the onset of the pandemic, we quickly pivoted to most of our services being delivered via telemental health, which is video conferencing with parents and their children. We continue to deliver emergency supplies to clients in need, so food and diapers, and we are an essential service. We continue to be an essential service, and folks continue to come to work every day, and I can't express to you the gratitude that I have for these folks. I think that while we've really showered our medical folks with gratitude, I don't think our mental health folks have received anywhere near that level of support. I think we're only beginning to understand the negative consequences, the long-term negative consequences on children's mental health. There are studies that are now coming out of Western Europe, primarily out of Spain and Italy, that are really pointing to the long-term negative impact of the pandemic on kids and families. So while our families, we've had this shared experience, and our families, not like some families in Spain have been quarantined for over 45 days where kids were not allowed to leave the home, we're seeing similar outcomes for our kids. So it's no surprise. We've had this shared experience. So kids are worried about their parents. Kids are worried about their grandparents. They're worried about their friends getting sick. They're worried about never seeing their friends again. So what we're seeing is increasing levels of isolation, increasing levels of anxiety in kids, increasing levels of depression in children. I think what I'm seeing, I think this has been a fantastic video conference in that I see the commitment on the part of providers to ensuring the safety of children and their staff. And I think that's what parents need to understand. If parents are ambivalent about going back to work, if they're not sure about their safety of their children, they are not going to feel safe at work, or are not going to be at ease at leaving their kids at either a daycare center or at a summer camp. So again, I see the commitment on the part of all these providers, and I think that's what parents need to understand. They need to understand what the CDC guidelines are. They have to educate their own children about taking care of themselves and what protective measures they need to take. So there's an element of empowering yourself, empowering your children, but also clearly understanding what the guidelines are going to be in that alternative child caring site over the course of the summer.
Michael, you talked about the challenge, and these are the unsung thoughts and challenges we've all endured. And I'm appreciative of you raising the potential dangers. But talk about what all of these camp coordinators and the commissioner through early childhood, their understanding of that and moving toward a new normal, getting the initiative where they go back and with the new parameters, get back to some level of balance and engagement. It's ultimately going to be a decision, but that's why I felt the program was so important. It was important for parents and children to see the light at the end of the tunnel and
right.
the empowerment that they feel
right.
to move through this phase. It's not going to be short term, but these are tools. These are organizations that are taking every precaution. And how important is that? And how much of a balancing act for these parents to make these decisions with data, with information, with contact with them? But how powerfully positive could it be for them to get back to moving forward?
Right. So as I've heard Commissioner Bai say on a number of occasions, kids thrive in structure and routine. They haven't had that for the last 10 weeks. I think that they've been, there's been a full spectrum of kids either getting just a few hours of schooling a day to a very limited number of kids getting up to 6 hours of schooling a day. They need that structure. They need routine. They need to be with their peers. And I think that's the level of reassurance that we want to give parents, that this is what they need, and the providers are going to provide that for them.
And I'm going to pivot and talk from a parent standpoint, that you kind of give a lot of thought, you prepare, you do your homework, but ultimately it comes back to say, I don't feel comfortable, right? But then you've got to go to work and you've got to make decisions. You've done everything right, and you send your kids to childcare or camp. And then there's that nagging concern is, am I doing the right thing? And the paternal guilt of whether I am doing the right thing. What kind of support and you've seen and you can offer to parents that kind of go through that emotional roller coaster? And sometimes they don't want to say anything about it because obviously it's a sign of weakness. It's a sign of, guilt. How do you address that?
So I think what we find is not only are children isolated, but parents are isolated from their peers, so that they've been essentially cut off from those support systems and not being able to share those concerns, those fears with their friends, with the kids who are in their own schools. And I think the act of voicing what those concerns are, in some ways you're validating what your own concerns are and getting support from other your neighbors. I think that's what we're missing out on. I think that's a huge a piece that we're missing.
And obviously we're doing this through Facebook and through Zoom and all these other meetings. Can you give some input of using that as a tool, but also throwing caution to some of the negatives of the social media bandwidth issues?
You know, I do a lot of teleconferencing, as I'm sure you are. People are getting really tired of attending these kind of meetings. It doesn't take the place.
No, come on.
It doesn't take the place of human contact. We need that. And how do we do that in a safe way? And I think people are going to have to start figuring out ways of opening up their own kind of personal relationships while keeping a safe distance. And I reaching out to your peers, I think is invaluable at this point.
Well, I want to respect people's time, and even though we had a late start, I think in closing, I do want to thank the commissioner. I want to thank each and every one of you. Anthony, I want to thank the First Selectwoman, Brenda Kupchik, for her efforts, and Sabrina, through David Blodges, Tim Cipitelli, and all the various other people that make your programs work day in and day out. And to Diana, and also Tim Bartlett, who has been very active with a lot of activities. It's remarkable that we're going through this unprecedented time, but I'm also optimist in taking a look that this has created a new paradigm and new resolve. And for us to be able to talk about challenges, and I think one unifying term, and there was a positive that I saw, that people are more united than ever, and understanding that there are no exceptions. There are no red and white. This pandemic impacts everyone. And that it is a remarkable unifying to recognize that we're all in this together, and that we can only solve this when we're united, be as one. Whether it's Michael talking about interacting with people, you gotta follow the CDC guidelines. Wear your mask, be respectful of others, but also be protective of yourselves. For all of you who've taken the yeoman's effort to prepare an environment that is safe, but also interacting and challenging. And for the commissioner to give her time and give her personal email for all of those that are listening and all of those that may be applying for waivers and questions. It really is one where not everyone's always happy, but we're all working together to solve this. So I will post this video onto my website. We will share with everyone your organization's contact website and information. We will put up the PowerPoint information provided by the commissioner, and we will give constant update moving forward. This is just an early part of a long marathon, but ultimately, when we're all in this together and we're all collaborating and we are able to voice disagreement and challenges, is the way that we will overcome this and be better for it. So I want to thank all of you for participating. I want to thank all of your organizational staff and support in doing this. So with that said, I want to thank all of you that have listened in and been very patient. We're going to take your questions. We're going to do our best to try to respond to the best of our ability. But most important of all, I hope we've given some perspective, some comfort, some sense of information and direction as you explore the idea of being able to prepare childcare plans and also summer camp activities for your loved ones. So thank you very, very much. And everybody be safe, be healthy. Have a great one.
Thank you.
Thanks.
Thank you very much.
Thank you for doing this.
Oh, it's a pleasure. Thank you.